Hi, this is Shayla with Whole Motherhood, and you are listening to Moms Learning with Moms. Today we've got Sam with us and her little baby Olive, which you will probably hear in the background. Sam is a speech language pathologist. Is that correct? All right, and she's gonna kind of walk us through what she does and how she helps kids, and maybe some things that we can do to be aware of what problems are out there and how to help our own children. All right, Sam, let us know about your background.
Yeah, okay, and I will apologize. My daughter Olive is with me, so I'm doing the thing that speech therapists don't recommend. I'm just going to turn on the TV to distract her. So I'm a speech language pathologist. And a little background on my journey to speech language pathology. I was in my second year of my bachelor's, and I had changed my major a few times. I started out doing journalism and then realized I have way too much anxiety for that. I switched to English because I wanted to do writing. So when I found speech pathology, I was actually doing art because I was going to try and do graphic design, and that was not it for me, but I do love art. That summer before, I actually did a study abroad in Chile because I had been taking Spanish courses, and I just got really frustrated being in Chile and not being able to communicate with people as effectively as I do at home because I had very basic, limited skills in Spanish. So I think that kind of got me interested in speech pathology. And one of my friend's moms let me shadow her at a school, and I really liked that. I liked that the speech pathologist wasn't a teacher over 30 kids, but they just had a small group. So I took some intro courses and just really fell in love with learning about how we like language is formed and how there's different components of language, because it's something we just kind of take for granted that we are born and we just hear words and we start imitating and suddenly we have language. And unless there's someone who or someone close to you that like has a hard time with that, you might not necessarily think about it. So and my younger brother has autism, and he doesn't speak to communicate. He has very limited expressive communication, and I think that was another thing that I knew I wanted to work with eventually. Like, some part of me wanted to work with kids with disabilities, but I didn't want to be a special ed teacher because I knew how hard that was. Yeah, that's kind of my background of how I found speech pathology, and it took me a little while to get into grad school because I worked after my bachelor's as a speech language technician, which is also called a speech language pathology assistant out here in SLPA. And so I did that for a while. So it took me a little while to get into grad school too, because it's really competitive as well. So do you see this page with the who needs a speech pathologist?
Yeah.
Okay, so I was trying to find a better visual. I don't love this one, but this does have a lot of what speech pathologists do. And so, yeah, speech pathologists, we work with basically across the lifespan. There's a lot of different, I guess one of the phrases we use is that speech pathologists wear a lot of different hats. So there's a lot of different areas that we treat with speech pathology. So the newborn to toddler age is typically early intervention, and we work on language development, sometimes speech. We work on play as well, especially with kids that have autism spectrum disorders. We work on building some of those pre-linguistic early communication skills. And then school age, that one, it's kind of the same. We can do stuttering, language disorders, or speech sound disorders. Into adulthood, a lot of speech pathologists work with adults that have had strokes or have had traumatic brain injuries, and just have difficulties formulating language after a stroke. A lot of different injuries to the brain can impact how we communicate. So there's some rehabilitation there. And then the one that not a lot of people know about is, or I guess don't associate with speech pathology all the time, is feeding and swallowing. So we work with adults that have difficulty swallowing due to like age or stroke again, or an accident, or cancer treatments can sometimes impact your swallow if it's with your throat. And then speech pathologists also work with kids that have difficulties eating and swallowing. Oh, I think the only one I missed was voice. We do work with voice patients too. So people who have vocal nodules or people who have hurt their voice, or just are getting rehabilitation for their voice. We also can work with people who are transgender and they want their voice to match their identity that they have. So just working on changing and like shifting their voice that way. So yeah, there's a lot of stuff that a speech pathologist can do. I don't know any speech pathologist who does all of it. I usually will have speech pathologists who specialize in a few areas.
What do you
Yeah.
specialize in, Sam?
Yeah, so right now I work at an outpatient clinic, which is basically, it kind of functions like a private practice. I work with pediatrics, so I work with kids. Right now I'm working, it's usually 2-year-olds up to, I think my oldest kiddo I have is about 10. Yeah, so I just kind of work with that age range, but could go with older kids too. I work with a lot of kids that have language delays or language impairments. So they have difficulty, and I'll go into this too with language because it's a very big area. But yeah, so I work with kids with language impairments. I work with kids that have speech sound disorders. So those are kids that have a hard time producing different speech sounds and words. I worked with a few kids with stuttering. I don't have as many on my caseload anymore because it's not as common. Yeah, basically I just work with kids 2 to 10 that have language, speech, or feeding. I do a few feeding kiddos, and that's a new area for me, so it's a little scary sometimes. But I'm taking courses, so learning about doing feeding. So when we talk about language disorders, like it's such a wide range of things that go into that. And oh, here's another one I found that just kind of goes over what speech pathologists do. And fluency means it's kind of like stuttering, like how fluent is your speech. Yeah, and I forgot about social communication. So kids with, autism usually will have difficulty with that like social connection piece. So we work on a lot of social skills and kind of learning social language. But I'll go into this. This is what you would get from like a basic intro to speech pathology course. So in language, there's 3 components of language. We have form, content, and use. And form is how we say it. So this includes phonology, morphology, and syntax. And I won't go into all those, but basically word order, word endings, and then phonology is like the specific speech sounds. And I didn't mention this, but I do a bit of like, so phonemic and phonological awareness are key skills for reading. So a lot of what we do with our younger preschool, kindergarten age kids, like a lot of it kind of correlates with these like it helps with reading some of these like phonological and phonemic skills we go over. So I do a little bit of like literacy and reading help. It's not like you probably get more from a reading tutor, but we do help to build that kind of foundation for reading because a lot of kids with speech sound disorders have a hard time with reading. Yeah, and then content is what we say, or it's kind of like your vocabulary bank, and that's what we call semantics. So it's word meanings, how we link words together. Like if I told you I have a banana, a cherry, an apple, and a chair, like which one doesn't belong? You would know it's not the chair because the other three are fruits.
Right.
So kind of linking words and meaning together. And we do this naturally. Like we just learn words and like through our experiences link that meaning. And sometimes kids just need that explicit teaching to help them understand and link those words and that meaning together. And it's crazy to think about like it, how it like kind of shapes your world, like knowing different words and linking them together. But a book I read talks about how some optical illusions don't work in other cultures, like because we use a lot of like 90-degree angles in our like world and they don't, which is so weird because we're the same,
Oh.
like we're the same planet, same world, but like different cultures sometimes like the way they view or talk about things shapes their view of things. So it's just so cool to learn about how language like forms and communication and how just differences make our views different. And that's why too, when we work with kids that are bilingual or trilingual or like multicultural from a different like country, like we really have to take a lot of that into consideration, and we can't use standardized tests with them that are based on a bunch of white kids out of Iowa, like on their scores. Like we really have to do that dynamic assessment and like look at what they're doing and take that into consideration. And then the last thing on there was, just the use, the way we say it, are pragmatic. So these are your social kind of conversation language rules. So I like to, for this one, say, you wouldn't talk to your grandma the same way that you address a professor. So we have these different little nuanced rules when we talk, but we don't really always, we don't always think about it because we just do it naturally. Like when I'm talking to my grandma, I switch and I use, my language that I would with her. And, it's going to be different than the language I'm going to use with my friend, where we might use like slang or current terms,
Yeah.
so that's content, form, and use, and those are kind of the basis of language. And so we work with kids when they have a hard time with any of those areas, either the vocabulary, grammar, speech sounds, or the social part of language. So it's really cool to learn about, though. Like I think most people would really enjoy taking an intro to speech pathology course just to like learn about the different ways that communication is formed and different
Yeah.
parts of communication. So
What are the signs that someone would start having a problem with the language?
depends on the age. School age, what you might see is the difficulty with reading. You might also see some grammatical errors that typically are gone by that age. Like
Hmm.
if the kid is still saying I runned away after, like, if they're in first or second grade and they're still saying I runned away, or having some difficulty with the regular past tense verbs, or they're leaving off like plural s's or possessive s's. So like mommy chair, and they're saying mommy chair beyond the age of like 3 and 4, like they're saying it and they're in school, then like that kind of shows us that there might be an issue, that they might not be like mapping those different grammatical pieces, or and that's the hard thing too. Like sometimes it's just very nuanced, because some kids are just really smart and can kind of mask it and get by. If it's difficulty with vocabulary and like kind of the categorization of things, you sometimes see it come out in like the schoolwork, I know it's it's hard because it's just so vast. But a lot of times there will be a little bit of a difficulty across schoolwork areas. Sometimes math not as much because there's not as much language in math, but like the um the like word or story problems in math, you might see like a little bit of that difficulty there. So
Does speech language help with dyslexia?
um we that's a good question. We work with a lot of kids that have dyslexia, but if a child only has dyslexia, oftentimes in the schools they won't qualify
Mm.
for speech, depending on yeah the level.
Hey, I have actually kind of a personal question because on there it said that they work with voice and resonance. Does that
Mm-hmm.
mean that you guys like work with like singing? Like, do people come with like, really?
When I did my externship in New York, we actually went to like a voice lab where they had a voice lab and they would work with yeah singers, and I think they'd like worked with a few famous singers. They couldn't say anything because of HIPAA, but like
Right.
they're pretty well known, and yeah, they like had a piano up there, so really a lot of like voice rehabilitation. They talked about some singer that like had been doing a show and they had confetti and they accidentally like inhaled the confetti and then were coughing like to get it out, and it like damaged their vocal
Oh,
folds because they were slamming together so much with their coughing, so they had to like kind of do some of that voice rehabilitation. What I remember from my course is there's just a bunch of exercises that you can do to kind of like
retrain.
improve yeah a little bit, and then also to improve like your vocal hygiene. Like if you start every word that you say like really pushing your vocal folds, then that can damage them, so you kind of do different extra exercises to
Huh.
make it like make your vocal folds like a little bit easier. Like I actually have pretty bad vocal fry. I think it's definitely a um like an area thing because tons of girls in California have vocal fry. Utah, there's tons of vocal fry. It's just that kind of like not talking like this. And
Yeah.
I'm really like overdoing it now, but like Kim Kardashian talks like this. Like it's really cool. And it's not bad for your vocal folds, but like every time I was in my class, my teacher was like, you gotta fix it. So there's different like
That's
exercises you can do. Yeah, it's pretty neat to learn about. I think if you are worried about it, I might go like sometimes if you go to an ENT, they can do a scope and actually like look in it, it's a video stroboscopy, so they'll either
hmm.
go through your throat or through your nose, which isn't super comfortable, but they put a little probe back there and then they can see your vocal folds like moving while you talk or sing. And then that way you can see if you have like any vocal nodules or if anything's wrong. Like sometimes vocal coaches know. I think speech is a little bit more trained on like how to fix it. Even like the transgender thing, like working with individuals that are like wanting to shape their voice, like that's really cool too. Like learning how like women like if you speak more from like the front of your mouth, it sounds or like the front of your like like orifice, like it sounds more feminine, and then to sound like more masculine, like lower the frequency, like you speak more from the back. So yeah, it's just a lot of cool stuff. Yeah, so the next thing you asked this, and I feel like a lot of parents ask this, is like when do I know that my kid needs a speech therapist, or do they need help, they're not doing this. And I do have some like milestones and guidelines. I just say like honestly like kind of follow your gut once you like take in the information. Like if you feel like something's wrong, you like it's better to just get it checked out early. A lot of research has shown like working on speech and language earlier is better than waiting till they're school age. And that's not bad either. Like if your kids are school age and you're worried, like still get them checked out. But yeah, the early intervention just goes a lot faster because kids' brains are just so fresh and the plasticity they
Malleable.
learn. Yes, yeah, they learn a lot more quickly. And it's kind of like that, like if you want your kids to speak, or kids learn a second language a lot faster when they're younger because their brain can just like soak it all in, if that makes sense.
Where do kids
um,
get tested?
that's a good question. You can get tested through the schools, or you can go to like a private clinic or an outpatient clinic, like where I work. I will say our outpatient clinic, our wait list is 180 kids. It's so long, and it's probably like a year and a half wait,
Oh,
a year to year and a half wait. So that's the other reason why I tell parents, like, just get them on the wait list because
right.
if in a year or two they don't need help, then that's great. You can, but like you don't want to wait super long because then you'll still have to wait. So if your child, this is at least in Indiana, it's different in every state, but if you are in Indiana and you are worried about your toddler and they are younger than 3, you can get them signed up for an evaluation through First Steps. So First Steps is done through the state, and it's basically early intervention. So if your child qualifies for speech therapy, what will happen is a speech therapist will come to your house once a week or once every other week, depending on kind of scheduling, but usually it's once a week. They'll come to your house for an hour and just work with you. Oh, okay. They'll work with you and your child on different like speech and language areas. Usually it's language when kids are really young. It's hard to really like, so when kids are learning language, we'll start working on speech sounds a lot of times when kids are at least 2.5, like 2 or 2.5. So like then that's actual like forming of sounds. And even then that's a little early, depending on the kid and depending on, what kind of disorder they have as well. Like apraxia of speech is a more severe speech sound disorder. And so that one you might start working earlier, but yeah, it's hard. It's hard to even diagnose it that early. So basically a lot of what we do is language treatment. Okay, so that's First Steps. So they'll come to your house and work with you and your kid just to get your kid talking, saying more words, saying more phrases, or some of those early pre-linguistic skills like playing together, looking at each other while you're playing, or just joint play together. So that's one way that you can try to get speech therapy services. I will say right now the waitlist for First Steps is also very long. If you have any worry at all, I'd say just like sign up to get services, and then if your child's fine, then that's good. But just
Yeah.
the wait lists are so long. And if you don't know how to sign up for that, you can always talk to your child's primary care provider and they can get it set up for you for them to come evaluate, and they'll get the referral sent in. And the primary care provider can send a referral to places like where I work as well, like a hospital kind of outpatient clinic, and then you could be on that wait list too. If your child is over 3 but under like kindergarten age, contact the school district that your child is going to go to. You have to kind of use specific language, but say like, I want my child to have a speech and language evaluation, and just say those words. And then the school district has to get your child an evaluation. They have a 50-day timeline, so that is a long time because it's school days, so that's about like 3 months. But some kids, if they need that help, they get that evaluation. They'll either be in developmental preschool, which is free. Depends on what school district, how long they'll be there. Like some kids go 4 days a week for like 4 hours a day, and some kids go once or twice a week for 2 hours. So it depends on the school district. But yeah, that's another option. And then if your child is school age, you can just call the school and ask to speak to the speech pathologist and say that you want to request a speech and language evaluation. The speech pathologist, the school needs to get back to you within 10 days. That's kind of like, there's different laws with the school district, so they have to get back to you if you didn't directly talk to the speech pathologist. And then once you agree and sign the paperwork, then there's 50 days that the school has to evaluate your student. Yeah, and if your kid is school age too, and you're still like, maybe they are getting speech pathology at school, but you don't feel like it's enough, you can still get outpatient or private practice speech pathology, and then that kind of helps because they have double the amount of therapy. So
Wow.
more is always typically better with therapy.
So, do you think there's a reason? Am I just seeing things that it looks like kids needing speech help is on the rise? Or do you think just more people are aware of it, that there's problems and that they need help?
Yes to both. I think it's on the rise. I think there is more of a communication gap because of all the screen time. And this is me as I am making my child watch TV
I'm
while I
so
try to do
sorry.
this.
It's my fault.
No. Like, and I mean, it's so hard too, because you'll get a first steps evaluation. They're like, you shouldn't watch any TV. And it's like, well, parents are going to have their kids watch some TV. So I always tell parents, like, don't feel guilty if your child is watching a lot of TV. Like, just think about like how that's impacting them, because you don't learn language through TV the way that you learn language talking with someone. Like, you wish you did, because then kids would be talking a bunch, but often you need two people to strengthen communication and language. So if your kid is watching TV a lot, or that's what they love, like, try to cut it down. But if you can't, like, try and watch the TV with them and comment on it. That was kind of the like purpose of Sesame Street, was they wanted to make a show that moms would watch with their kids. And I love that, because that's, that can help, like, if you're watching and talking about what you see. So I think there is a rise in just language delays because of all the screen time. And I'm not trying to like shame anyone, but I think it's, an easy fix sometimes to just put your kid in front of the screen, like today. So yeah, I think that has increased some language delays. I think there's other disorders that we are getting better at recognizing and diagnosing, like autism spectrum disorders. There's, it's not just this like black and white diagnosis like it kind of used to be. It's, a lot of adults are coming out now and getting diagnosed that they're on the spectrum. So I think there's more prevalence of some disorder or some communication disorders, but they're like, they were always there, we just didn't know, kind of thing. So I think both of what you said is correct. I think there's a little bit more of disorders, but then also we're like getting better at recognizing delays and things. But I think the more important thing is the one-on-one, like, face, or not even one-on-one, like, you can have your other kids there too, but just that face-to-face, like, playing and like engaging in what your child is engaging in. But yeah, so I think just that one-on-one playing with your kid and like doing what they're interested in and kind of following their lead. And that's hard sometimes, because I'll like get out the blocks with Olive and I'm like, we're gonna do the blocks, it's gonna be fun, and then she wants to play with like the phone cord or something, and just like following their lead and talking about the phone cord or talking about whatever it is they want to play with, like the spoon, playing with your kid one-on-one, that really helps, especially like the toddler age. I think even with older kids too, we've taken away a lot of like play and enjoyment from, at least from school. I think like when I worked at the like kindergarten, they only had one recess all day. And it's like kids need to play and to be engaging like all their senses. And
Hmm.
I think the schools have just gotten really focused on like numbers and like pumping out the ABCs and sight words. And it's like kids need the social engagement more than anything. Cause like, does it matter if our kids can like do all these academic things if they can't communicate with each other effectively, you know? But that's a whole nother thing. That's a whole nother soapbox. But and for younger kids, what you can do is repeat back what they say. So like if Olive said ball, I would say ball and then expand on it, like red ball or
Okay.
go ball. Another thing you can do, and this is for language, I'll go over speech in a second because speech is a whole nother a whole nother kind of world of within language. You can also kind of fix what they said but not correct them. Like if your kid said like mommy bag, like yeah, that's mommy's bag, like just kind of fixing it but like modeling it but not being like no, say mommy's bag. One thing I love is, as moms, we just kind of innately know what our kids need. They don't even have to say anything. They just like look and point or just like look and we're like, oh, they need their cup, they like this cup. And we get it for them. So I like to do a little bit of like sabotage and being like, oh, what, this, and like grab the wrong thing, or just like playing dumb and making your kids say give cup or I want cup, or using more of their words, or even if it's just cup. Or some kids like getting them to point, like that's, we're working towards different things. And sometimes I'll use it with older kids too, like we'll be doing a craft and I'm like, oh, and they're like, put it on. And I'm like, oh, put the glue on your head. And then they're like, no, on the plate, like trying to get more language out and like using those words. So that's another one I love. And you have to kind of play it by ear. Like if your kid is having a terrible day, like you probably don't want to use a lot of sabotage. If it's just like a typical day, just having something out of reach or something that they can't open, and not just opening it for them, but waiting for them to come to you and like give it to you or say open. That's a great one. And that's a hard one too. A lot of times, like I just ask a bunch of questions, like, what are you doing? What is that? And that can sometimes shut kids down. So if they don't respond, just commenting more, like, I see you have that, or like, I see you're mad, like, different things. A speech is very hard because there's just so many different like things that could be happening, or like, issues that different kids could have. But
Well, Sam, what is the difference between speech and language? Like,
well, so speech like falls under language. It's kind of that like phonology portion of language under form. So speech is just the way that we form sounds.
okay.
And sometimes kids will have an articulation disorder. So that's a disorder of like actually making the speech sound. So some kids have a really hard time with R, and it's just getting that formation. Like they know they're saying it wrong, but they can't move they don't know how to place their tongue to get the R. Or S, like kids who have a lateral S where air comes out the side, like something like that.
Yeah.
Sometimes it's a structural thing with their mouth or their tongue, or it's just they don't have the right placement for that, and they've been doing it that way for so long that you have to retrain how they do that. And then there's another one. So that was articulation, and that's just difficulty making the sound. And then speech sound disorders, those are kids that can make the sound correctly, but they're not hearing the difference. So like the example I like to give is in Japanese, they don't have an L sound. So often when a Japanese learner is learning English, they will use R for L, because it sounds really similar. Like they don't have an L, so it's R that their brain tells them that
Wow.
sound is. So another example is, I don't remember what language it is, but there is, I believe it's a Middle Eastern, I'm not sure, language, but there is a sound between a P and a B. and we can't hear it because we don't have that sound. So if someone from that language used that sound, we would just think, oh, that's a B. But if we tried to say that word in that language, they would be like, you're doing the wrong sound.
Wow.
Isn't that crazy?
Yeah.
So that's what happens with some kids. They, you know, aren't differentiating the small, tiny differences between sounds. So you'll hear kids who say, this is a really common one. They use T and D for K and G because they're very similar, but and they only differ by like one little feature. So kids
Hmm.
sometimes don't hear that difference, and they'll say it's a tau for cow. And you're like, no, it's cow. And they're like, I said tau. Like they
Okay.
don't hear it. So you have to kind of train that, which is crazy, right?
Yeah. Oh, that's just so interesting. Okay.
Yeah. Yeah. And some of those errors though are typical. Like some kids will use tau for cow, like use that error. It's typical until you're about 3. It might be 3.5. I think it's about 3 though, because there's actually been new research that most of your speech sounds, you should have most of them by the time you're 7. So there's some errors that kids will make that are pretty typical like that. And that goes under speech sound disorder. And then there's another disorder, and that's apraxia of speech. And I won't go super into depth with that one because it's a little bit, it's not as common. It's basically nothing is wrong with your mouth, but your brain to mouth connection, like the way that you motor plan sounds, it's just off. Like it's difficult to coordinate. So an example someone once said was like, you know how when we type we use QWERTY, and we've learned that motor memory and we can just do it. Like apraxia speech is like if you did that but you change the keyboard every time, so you're
Hmm.
having to like kind of learn how like your brain just kind of switches it, if that makes sense. So that's apraxia of speech. Those kiddos have a really hard time with like the motor planning. So the treatment for that is very different from the phonological speech sound disorders, and it's different from articulation. Speech pathologists wear so many hats. There's so much with each area, and so sometimes it's a little overwhelming. You can help with speech at home too, like the specific sounds, but depending on what's happening, the treatment's going to be different. So that's why I think, yeah, if your child is 4 and most people don't understand what they're saying, get them evaluated. If your child is, you know, older than 7 or older than 8 and they're still saying some sounds wrong, like just get them evaluated, just check it out.
I
Yeah.
found, I don't know, when raising my own children, that they would have some like flipping of letters and everything.
Mm-hmm.
But when they started reading, it seemed like most of them, well, all of them just kind of figured it out. Is that usual?
Yes. Yeah. And I actually love that too, because when kids like learn to read, sometimes that's like all it took, that they're like, oh, this says this sound, like, you know, it
Yeah.
kind of helps strengthen that. So yeah, reading can really be helpful. And that's also why kids that have speech sound disorders often have a hard time with reading, because they're like, K says K, and they're like, oh, but T also says T, you know, like they think K is T and T is T. So like, and that's not exactly, but like you just have a hard time because you're not hearing the different sounds. So reading is harder. But yes, sometimes reading just helps so much with that, because they're like, oh, it is different. Like,
What's some last advice you might give a mom who's worried about their child speaking?
again, when in doubt, either reach out to a speech pathologist friend if you have one, or just try to get them screened or evaluated somewhere. The
Hmm.
second thing is, I always try to tell parents this, like, if your child has a speech or language delay, like, it is not anything you did. Like, it's nothing you did wrong. It's what we call idiopathic. It doesn't typically have a cause or like a reason that we can find. Like, it's just something that happens, and you know, you could have done everything right and they still have a disorder, and that is okay, and it's not anything again you did wrong, and to just keep trying and keep working with them and just loving and communicating with them is
Cool. Sam, this has been so great. Thank you so much. I really appreciate it. I think even just what you've shared in your education just makes me want to learn more about it. It's really an interesting subject. I think it could help a lot of people. So
mhm. No
we're gonna
problem. Thank you.
we're gonna encourage everyone to just keep learning, and we'll see you next time.